Hi everyone, it's so nice to be here again from Unified Oski. And I would like to say a big thank you to all our subscribers. Thank you for the comments, for the shares, for the likes. We are grateful. And if you haven't subscribed, please don't forget to do so. In today's video, I'm going to be talking about one of the most failed stations in Oski, which is the implementation station. It's a talking station and it is 15 minutes. I'm going to be discussing some of the reasons why candidates fail and how to avoid these mistakes. So the first one is failure to validate all your prescription charts. Yeah, my words, I said all. So it doesn't matter whether that medication is due at your time or not. You have to read all the medications on your MAR chart. Now, what do I mean by validating? Is there a prescriber signature? Is there a blip number? Is the patient allergic to this medication or not? Is it legible? Does it meet all the 6 rights of drug administration? You know, the right patient, right medication, right dose, right time, right route, right documentation. Does it meet all these criteria? So if it doesn't meet all those criteria, then that medication is not valid. I know a lot of candidates ask about pharmacy check. So for the pharmacy check, it's not one of the things that makes the medication valid or not. If it's there, it is fine, you read it out. But if it is not there, then it doesn't mean that medication is not valid. All right, the second reason why candidates fail is administering a medication that has been given under the start dose. Even sometimes candidates forget to read that once only and start dose medication, but it is very important for you to read it. If you don't read it, how will you know whether it's been given? When you get to regular medication or under antimicrobials, how will you know whether that medication has been given under start dose or not? So it's important that you read all the medications on the once only and start dose as well. And there's another important thing while checking your medication on start dose. You know, there's a column for time required and time given. They are both important, but the most important one is the time given. For instance, if you're on regular medication and this patient has been prescribed paracetamol and you're administering that medication at 2 o'clock, that is 1400. Now, if you check on the start dose and you discover that, oh, this patient had paracetamol as well, and for the time required, it was required at 9 a.m., but it was given at 11 a.m. If you look at the interval between 9 a.m. and 2 o'clock, you might say, oh, it's over 4 hours, so I can give this paracetamol, but it wasn't given at 9 a.m. The time given states 11. So if you look at 11 to 2, that's a duration of 3 hours, which is not safe for that patient to have another dose. Okay, so it's important for you to look at the time given, not only the time required. So use the time given to look at the duration, whether the patient is safe to have another one or not. Okay, so that is very, very vital for you to look at all those things, especially paracetamol is always used as a trap sometimes. And the third one is administering a medication that the patient is allergic to. You know, that's a big patient issue. So, you know, at the start of that station, you will have asked the patient, you've done your identity check, you will have asked the patient about their name, their date of birth, cross-checking with the document in your hand and their wristband if there is any, and also you will have asked about the allergy of that patient, but it's possible that you've forgotten. So when you get, especially on the antimicrobials, it's important for you to go and check again, what's my patient allergic to? All right, so that you don't give a medication that your patient is allergic to. If you have forgotten, just go and check. It's on the second page of your matcha. Just double check what's this patient allergic to. All right, so and then the fourth reason I'm going to share is failure to verbalize or validate the medication that you are dispensing. Now, you have read all your charts, you have validated all the medications on that chart, and now you want to dispense the medication. It is still important, it is necessary for you to validate the medication that you are given. I will still cite the example of paracetamol. Now, on the bottle, they write the strength of the medication, they write the name of the medication, the expiry date. So you stated this is paracetamol, it is expiring 14/2/2026, and it comes in 500 milligram per tablet, and you stated probably the patient has been prescribed 1 gram. Okay, so my patient is to have 1 gram, and I'm taking 2 tablets, so I'm dispensing 2 tablets. Don't assume that your assessor can see you. You have to verbalize that. What are you doing? How many tablets are you giving to this patient? So it's important that you actually verbalize what you are doing to the assessor. And the next one is failure to complete documentation. You are reading the chart and you discover that, oh, I'm not going to be able to administer this medication to the patient. Probably the patient is allergic to it, or you just feel that prescription is not valid. So at that point, for you not to forget, just quickly code it. If you're given a code of 2, a code of 5, just quickly code it and then put the signature on top of that code. Remember that your code must be very, very bold, right? You put the code so that you don't forget. And at the end of administering all the medications, when you're documenting, remember at the last page of your MAR chart, you're going to document all the omitted doses, all the medications that you have omitted. You're going to document it there. And at that point, you're going to write the reason why you've omitted it, not the code now. So you'll be writing the reason why that medication has been omitted. And for those ones that you have administered, the time is there already. So all you need to do is to put the date and then you put the signature. So make sure you document all the medications that you've given. Put the code, all those ones that you have omitted, and whichever one you've omitted, write it at the back of your MAR chart. And the sixth one that I'm going to be talking about is poor time management. Yeah. A lot of people run out of time in implementation, but if you're consistent with a lot of practice, you learn to manage your time. And another reason why people don't manage their time properly is unnecessary repetition. So when it comes to implementation, make sure you just don't repeat words unnecessarily. And in managing your time, don't start managing your time when the assessor tells you you've got 5 minutes more. Even right from the beginning, at the onset of that station, try to manage your time as much as possible, okay, so that you don't run out of time. Time management is very, very important. You might have the opportunity to do a viva if you haven't used that, if you haven't done any, okay, but what if you have used your viva already? So that time management is very, very important. All right, so these are the 6 first reasons why a lot of candidates feel their implementation station. I hope this helps, and we wish you all the best in your exam. Hope to see you some other time. Thanks for watching, and bye for now.